Hello and welcome everyone. Do you have facelift questions? If you do, you have come to the right place. I am Dr. Rich Castellano, double board certified facial plastic and reconstructive surgeon, and we have the answers to your questions based on my experience of over 4,000 facelifts under local anesthesia and injection of over 20,000 syringes of filler. In this video, we will go over the most common questions we get about the face and facelifting. The goal here is that you have all the information you need to make the right decision for you. And as I've said before, my job is that you know your options. This way the answers seem more obvious for you. Okay, let's jump right into our facelift VIQs. I get asked this question every day by my patients. What is the right age to start doing treatments? I don't want to start too early, but I don't want to wait too long. We did a great video about this. I highly recommend watching this in the Module 1 series. Some simple answers about when is the right time to start. If you're pulling your skin back along your jawline and you like what you see, then you can probably benefit from a lift. And you don't have to do a full traditional facelift. The real question is, what is your outcome? How much improvement do you want? Are you willing to have some downtime? And what are your personal standards for looking your best? All of those questions play into what is the right treatment for you and when you should do it. Did I just answer this question with more questions? Maybe I did. But when you start asking yourself those questions, the answers will become very obvious to you. This is personal and different for everyone. You need to find what is right for you and not for someone else. The next VIQ, or very important question, is how long do facelifts last? The answer is, it depends. There are lots of variables: how we take care of ourselves, general health, genetics, skin care, weight gain, weight loss, all can play a role in our longevity of our lift. We go through growth spurts, we go through aging spurts. The more we take care of ourselves, the longer the lift tends to last for sure. In general, when I consider all of my patients, people will usually wait about 5 to 15 years after a lift before they say, maybe I'll do more tightening. Some may wait 20 years. Some come back after a year or two for some tweaking. Again, it depends on our self-care and how we age, right? If we have a very stressful period in our lives, that aging can show on our face. Illness, job loss, anything that takes a toll on our lives can accelerate the aging and impact your lift results. However, no matter what aging you experience, after your lifting procedure, you will always be ahead of the game compared to if you never had any treatments performed. On to the next VIQ. Where are the incisions? Will they be noticeable? How do you hide them? The incision depends on the type of facelift procedure that you have. Traditional facelift used to make an incision high in the temple. Sometimes it would remove the hair in front of the ear, and that can be obvious, but it is absolutely not necessary. We also don't need the incision across the top of the head. The incisions I recommend are the hair-sparing incisions in front of the ear that heals to where it's almost impossible to see. The incision goes down in the crease, in front and behind the ear. This little bump, it goes right behind that. It's called the tragus, and right in front of the earlobe and behind in this area through the hairline. Many of my patients tell me they don't have an incision here, or they just can't see it, and that's because the incision placement is hidden so well. Have these VIQs been helpful for you? We're on a roll, and we have even more VIQs in the next video that you will not want to miss. We'll see you there.